Good morning. Well, I hate to interrupt that good conversation. This is a great crowd and a great energy, and I really appreciate you being here. I'm Owen Bailey. I am CEO of USA Health. No, that is not the United States of America. We wish it was, but it's the University of South Alabama Health System in Mobile. I also bring you greetings from the Alabama Hospital Association Board of Directors. I missed a meeting last year and they voted me chairman of that, so I hate it when that happens. We're starting a few minutes late because of me, so I apologize for that. I like to start meetings on time, but I had a little bit of a planes, trains, and automobile morning this morning. We have a graduating senior. It's our youngest child of 4, finishing Fairhope High School this year, and it was our turn last night to host the varsity soccer team dinner, of which my son's one of the captains, so I had to be there, obviously, to serve those big mounds of spaghetti that they eat the night before a big game, and so that went till about 9:30, but in my dedication to want to be here with you, I hopped in the car about 9:30 heading north from Fairhope. I made it all the way to Clanton. Spent a good night in Clanton, got up early, plenty of time. I just didn't, I'm still not trained like my children are to look at what the roads look like on the phone. And so I made it to, I don't know, 10 miles south of here where it's a parking lot on the interstate. I don't know if anybody else saw that. So it's backed way up. So I was so proud that I took an exit quickly, and I have ventured down every alley of Oak Mountain State Park and sat behind at a train crossing for about 10 minutes. So anyway, thank you for your patience. I apologize if I'm a little out of breath. It's because I've been sort of panicky in the car that I would not make it. So, but I'm really, really glad that you're here. This group, this forum, and the quality task force behind it's really made a difference in our state. And so whatever your role is in that, just know you're appreciated, and just know that you're making a difference. And that's really, really exciting to be a part of something that makes a difference, that really impacts people's lives. I mean, we really are in a life or death opportunity here to really make a difference. So thank you for being a part of it. This event would not happen without our partners. So I want to take a moment to recognize those who are behind this and make it happen. So I'm going to call out the name of 5 groups. If you're in that group, I want you to stand and keep standing, and we'll recognize you all when I finish. So if you're with the Alabama Hospital Association, would you stand up, please? We thank you. If you're with AQWF, would you stand up, please? All right. If you're with BD MedMind Services, please stand. I'll keep standing now. That's what my only instructions were, to keep standing. I want to really embarrass you as long as I can. Blue Cross Blue Shield of Alabama. Okay. And the Medical Association of the State of Alabama, please stand. All right, let's give these folks a hand. Thank you very much. Also, I mentioned the Quality Task Force. If you're a member of the Quality Task Force, would you please stand? And we want to thank you for your work. There's a few over there. Stand up, please. We appreciate what you're doing. Thank you. Thank you. Would anyone else like to stand? Sorry. All right, thank you. Really, there's always a lot of work behind the scenes for these things, and I want you to know you're appreciated. A few housekeeping items that I want to share with you. I mentioned BD MedMind. They're going to have a meeting during lunch, and if you're one of their customers and going to that meeting, you need to go to the bronze room, and your lunch is already going to be there. Now, for the rest of us, we will go out to the lobby and pick up our lunches and bring them back into here. So, and if you need a gluten-free meal, you just let one of the servers know. We do have free Wi-Fi here today. If you need to download any of the presentations, that information is on your agenda. If you don't have an agenda right near you, just look on the Wi-Fi options. It says Complex Guest. And to download the materials, go to aqwf.com, go to their news and events, and then to event calendar and click on the forum, and you can get access. Everybody's going to get an email evaluation following this meeting, and I want you to please take time to fill that out. For physicians and pharmacists, to get your CMEs and CPEs, you'll need to pick up a paper evaluation that kind of go old school at the registration desk. And nurses, If you want to help speed up those lines at the end of the session today, there's going to get your CEUs, there's going to be 3 signature lists available, 1 at each scanner and 1 circulating through the room at the end of the day. So take advantage of that opportunity to speed the line up. And also, an important note, you'll notice on the agenda there's no scheduled breaks. I know that sounds a little harsh, but feel free to get up and go as you need to. The restrooms are in the lobby. We've had an effort for several years now to engage more physicians in this quality forum. And I just want to ask, if you have a physician leader who's not already engaged, if you want to get that person on the email list, you just need to send that contact information to Margaret at Allaha. Margaret, are you in the room? They can point you out. Oh, right over here. Margaret's over here. If you have a physician or any other leader you want to get on the emailing list, give that information to Margaret. Couple thoughts just as I get ready to hand the program over to Keith. You know, we hospitals, other healthcare organizations you may be a part of, we play a large role in our communities. We make a big difference. We are big employers, some involved in education and research, part of an economic development engine, serving some safety net services for communities large and small. None of that matters if you don't get quality right. And so, again, and you know this, I'm preaching to the choir, but again, this is so vital to our state, to the citizens in the state, and to the care that we're provided. And if you look at the agenda, readmissions, repeat ED visits, star ratings, high reliability, ED throughput, antimicrobial stewardship, these are things on the cutting edge that we need to be getting right and making better and being hopefully a best practice for those around the country to learn from us here in Alabama. The Quality Task Force has been digging into that even deeper, thanks in the Hospital Compare, for instance, meeting with Bart Prevalley at AQWF, and they have a lot of areas where they're trying to focus on readmissions, especially hip and knee surgery, MRSA, excess days, and a lot of HCAHPS questions. So again, we appreciate the work of the Quality Task Force. They're also digging down into making sure that we accurately reflect the care that happens through improved documentation and coding and things like that. So you can hear more about that on the agenda. Finally, a couple of thoughts about Medicaid expansion. When I was here last time, I talked to you about where we were in this state and the great importance of having that happen for Alabama. You know, the number of states that don't is getting smaller and smaller, and we're still on that list. I would like to encourage you to go to alhealthmatters.com, the website. I'll say that again in case you want to write it down and haven't been to it. It's alhealthmatters.com. It has an incredible amount of resources on there and information. I will give you a little bit about where we are on this. We are really not using the term Medicaid expansion quite as much, but using the term Healthy Alabama, trying to broaden this because of the impact that is so much beyond just the mechanics of expansion. You look at states that have expanded, they are showing measurable progress in many indicators, prenatal care, cancer diagnosis, infant mortality. You can measure all kind of access-related improvements for states that have expanded Medicaid. So it is not, there's a huge financial impact, and it would make it, there's not many lifelines like this out there, especially for the rurals in our state, and we really need to take advantage of it. So 75% of hospitals in Alabama are still in the red financially, and if you look at just the rurals, it's up toward 90%. So there, like I said, there's not many lifelines like this. I would encourage you, if you have not, to speak to your legislator about the importance of this. So the thing I wanted to leave you with today is, yes, there is an economic advantage. There's not any deals like this out there for what you get back based on what you put in, and can make a difference in the state. But there's also a huge quality impact as well. Quality of life, quality of care, just doing the right thing for the citizens of Alabama. And I think what you'll learn when you look on that website, hopefully, is really understand about Medicaid and what it really is. There's a lot of conceptions out there about what Medicaid actually is. So again, just an encouragement for you to get involved and not wait on others to do it. Most of us at Allaha are speaking to groups, speaking to civic groups, talking to our legislators. We're in Montgomery and around the state. One of the joys I've had in being chairman is being able to go around the state to every council of Alabama, our hospital councils, and meeting with virtually every CEO and other leaders in the hospitals. We are really blessed in this state with some really outstanding healthcare providers, and I'm proud to be a part of it, and I know you are as well. So that's my pep talk about expansion. I hope you will do something about it, and I hope you will take it upon yourself at least to write a letter, make a phone call, speak to a group, tell your friends and neighbors. That's how the grassroots things happen, and we need it to happen. Okay. Now my favorite part of the program, I get to turn it over to somebody else. And I know you're tired of hearing me talk on. So Keith Granger, as I said last time, has been a friend of mine for, probably going on 30 years. I think we are blessed in this state to have Keith as a leader. He is really one of the most dedicated and hardworking leaders that I know, and I respect him tremendously. And Keith has been heading up the quality effort for, I don't even know how many years, Keith? 14 years. Wow. So Keith, in his day job, is regional president and market CEO for Community Health System. I think most of you know Keith or know of Keith, and obviously chairs the Quality Task Force. So he's going to be our host for the rest of the day. And Keith, again, we appreciate your leadership and your dedication to quality in the state. So y'all help me welcome Keith up here.
Thank you, Chairman Bailey. By the way, the part that you didn't know in all your hustle this morning, had you not made it here on time, the board was poised to reappoint you for an additional year as a penalty for failure to arrive. So you're safe now. Thank you, Owen. We do appreciate the diligence by which you've given your leadership this year. As we get started, I want to take about a minute or two and just frame a little bit of the background, so that as we go through our speakers today, we can all perhaps be a little more connected to what's happening on the national scene. I know many of you are going to be perfectly aware of everything I'm about to say, but I want to reemphasize it just to make this point. The discussion about measurement and quality is at center stage in Washington right now. CMS, MedPAC, all the legislative arenas that you can imagine are all talking about, are we measuring the right things, and are we aggregating the data in a meaningful way that consumers can really use it? As we all have pushed back at various times and said, measurement is important, transparency is important, but if you don't know what you're being measured on, or if it's not being displayed or aggregated in a manner that is meaningful to the consumers, are we in fact penalizing a lot of the good work that's going on in our hospitals? And I think there's frustration level in the industry certainly is very high. As you watch over the next couple of months, though, watch for the following. There's a lot of discussion about whether they're going to tinker with the current system of multiple components of measurement, whether it be the readmissions or whether it be the penalties applied in certain categories, whether it be the hacks, whether it be use of the current formulas for how it's computed. I mean, you have to be a statistician to figure out some of the formulas, and even then, those who help develop it can't even explain it. So it's created all kinds of issues. We've seen the 5-star report last year get shelved because of the controversy around it. Then we saw it get released in January. We saw some people who were one level in the fourth quarter of last year change to a different level in the first quarter. And we saw with the latest report here, we had 5 hospitals in Alabama reach a 1-star level, and we had a few more get into the 5-star level, but they basically flattened out the ratings, and again, a lot of failure to explain in an effective way. Your Hospital Association Quality Task Force joined many other associations in trying to give feedback to CMS, trying to give feedback relative to the issues we face. MedPAC has come out and said that they are advocating for combining the various measures together and reducing the number of measures around measures that matter is a term that's being used. So as because we are doing the hard work that all of you are doing, and I want to commend you for that hard work, because you're having to take the game as it's currently played, and I hate to refer to it as a game, but I don't know any other way to explain it. You're playing baseball right now, and you have certain characteristics that are measured in certain ways and reported in certain ways. Baseball might change and become more like football if they change the rules. So we're going to have to be able to change with whatever is put in front of us. And we have a tremendous adaptability in this industry to do that. But I think knowledge is the answer for all of us. Understanding what is going to go on and making sure that's connected to the care that we're trying to deliver in each of our institutions has never been more important. I think what we're working on will be embedded in whatever comes out of all those discussions. So we'll just watch it. We'll continue to provide guidance as we can through the Quality Task Force so that we can have all of 100 or so of our hospitals moving in the same direction. So don't lose faith. Don't get confused. We will do everything possible to share the best practices among our associates as we have done in the past, and we'll try to make sure that everybody has a good step moving forward. And today's agenda is really kind of designed for that. There are certain components that we are confident that will be a part of anything going forward. And today you're going to notice a lot of emphasis on readmissions. You're going to notice that there's a connectivity to the areas that was described earlier by Owen. When we look at the state data, particularly the data that Bart was able to put together for AQF and in terms of the aggregated form, we find the same common themes: mortality, readmissions, HCAPs, and then we've got pockets of our PSIs that are causing us concerns. We notice that we continue to have trouble with hip and knee complications, so we need to really be focused on that. And for the first time, we noticed that MRSA is really kind of all the infection arenas, MRSA is the one that we're having the most difficulty with. Alabama has a lot to be proud of. In 2011, when we passed the infection reporting bill, I think we got an early start in infection, and virtually all of our infection measures, Alabama shapes up very, very well. Honestly, I thought C. diff was going to be a problem in Alabama, but C. diff we actually rate very well. We're in the top of the country on our C. diff work. So great work by all of you. I can't tell you everything in 3 minutes or 5 minutes, but enough to say that's the work that's in front of us. And I hope that all of you are digging into your institution and identifying those characteristics and activities that should be center stage for you. We believe the agenda today is going to line up with some of those characteristics that you'll be looking forward to.